Can we hurry this up?
Make sure that...
Take your time. What's your name?
Hannah Morgenthau?
You have C.I.P.A, Hannah Morgenthau.
Oh, I don't.
We have to do x-rays to make sure you don't have internal injuries, blood tests to make sure no infections, EEG for neurological anomalies, and biopsy a spinal nerve.
Well, congenital insensitivity to pain is one of the rarest conditions on the planet. There's only been about 60 documented cases.
Yeah, and I have 7 reasons to think that she's one of them.
She says she's not.
And that's reason number 1. She knew what it was without us telling her. 2, she's still wet from the snow. She's not shivering. That's odd. Unless she can't sweat or feel hot and cold.
The ambulance was warm. I want to see my mother.
3, scarring around the lips and tongue. When she was a baby, she chewed on herself without feeling it.
I fell through a window when I was a kid.
4, when you cleaned the wound, she flexed into the cleaner instead of away from it. It's hard to fake pain when you've never felt it. It takes an imaginative leap, Ms. Morgenthau. It's one of them Jew names. Ashkenazis are a higher risk group.
On the other hand, she says she doesn't have it. And she'd be dead by now if she'd never been diagnosed.
They killed our Lord. You gonna trust them? She wants to see her mom. She admits having C.I.P.A. She knows we're not letting her go anywhere without a battery of tests.
You said you had 7 reasons.
I pulled the number out of the air. What, 5 isn't enough?
5 lame reasons aren't. I'm taking her to see her mom as soon as...
I could hit her again. 6 isn't enough.
Hello, my name is Guðmundur, and you just finished watching a clip from the television series House MD, where the fictional Dr. House, played by Hugh Laurie, encounters a young woman suffering from one of the rarest genetic conditions known to man, C.I.P.A. Now you might think that not being able to feel pain would be a blessing. No tears, no painkillers, no lingering aches. But really, not being able to feel pain is dangerous. Pain tells you when you've pushed too far, when you're in a situation you need to get out of, or if something has gone terribly wrong. If you step on a piece of glass or bang your head too hard, you know you need medical attention. But what if you never felt it? Congenital insensitivity to pain with or without anhidrosis are part of a family of disorders called HSAN, which stands for Hereditary Sensory and Autonomic Neuropathy. We'll discuss HSAN more later. But basically, people with HSAN disorder have trouble perceiving pain and temperature. People with congenital insensitivity to pain and C.I.P.A have a severe loss of sensory perception. They can feel pressure, but not pain, so they are likely to injure or mutilate themselves without meaning to. They might know they slammed their hand on the door. It just doesn't hurt. This inability to feel physical pain does not extend to emotional pain. People with C.I.P.A feel emotional pain just like anyone else. In this video, we'll discuss what C.I.P.A is and what it's like to grow up with C.I.P.A. We'll also talk about how people with C.I.P.A cope with it and cope with the disorder in their daily lives. Now we're going to show you another clip from the episode of House, this time showcasing some of the struggles C.I.P.A patients have.
I want to see my mother.
Hi again. I'm sure I could say this without being condescending, but then you get the false impression that I respect you. So you're a kid, you're scared, you're stalling. Grow up.
I'm not scared. I'm never scared.
See? How juvenile was that? You can't feel pain. Nothing left but pleasure. Why don't you tell me how wonderful that is?
It sucks.
Better than being in pain all the time. Get in the chair.
Every morning, I have to check my eyes to make sure I didn't scratch a cornea in my sleep.
Oh, God, stop. I'm in a pool of tears here.
I can't cry.
Neither can I. Every morning, I check my eyes for jaundice, in case the Vicodin's finally shot my liver.
I can't run anywhere without examining all my toes for swelling.
I can't run.
Boys can't hold me for too long because I can overheat.
Girls can't hold me for too long because I only pay for an hour.
I need an alarm on my watch to remind me to go to the bathroom. Know how many humiliating experiences before I thought of that?
Bathroom's 50 feet from my office. Every drink of water, I weigh the pros and cons.
After everything I do, I self-check. Mouth, tongue, gums for cuts, count teeth, check temperature, finger, toes, and joints for swelling, skin for bruises.
I got shot.
I sat on a stove when I was 3. Want to see the coil marks?
Yeah.
You think I'm lying?
You think I would just want to check out your tuchus, as your people would say? Put her in the chair and run the damn test.
Hi, my name is Ragnar, and children have a hard time growing up with C.I.P.A. Children learn not to touch something hot the first time they get burned. They cry when they scrape their knees, but a child with congenital insensitivity to pain is different. Many parents discover their child has an insensitivity to pain when an accident happens that should make the child cry but doesn't. After parents notice all kinds of bumps and bruises that don't faze the child, they try to figure out what's wrong. Because congenital insensitivity to pain and C.I.P.A are so rare, it might be difficult to get a diagnosis at first. Teething is a big hurdle to overcome for children with congenital insensitivity to pain. Just like any teething baby, they want to gnaw on everything in sight. But because they don't feel pain, they don't know when to stop. They might chew through their tongues or bite their fingers until they bleed. Babies don't understand directions, so you can't just tell them not to bite so hard. Some parents find it makes sense to remove the child's teeth. Once the child's adult teeth grow in, he'll be old enough to understand when not to bite. But this removal of teeth can make eating more difficult. At a time when other children their age are learning to enjoy solid food, kids with C.I.P.A are developmentally behind. Also, people with C.I.P.A often don't feel hunger pain, so eating feels like an unnecessary chore. Other very common injuries for children with C.I.P.A are corneal aberrations and other serious eye injuries. These come from scratching or rubbing their eyes too hard. Some children have to wear protective eyewear or use of special eye medicines. Now we're going to watch another scene from the same House episode that shows how careful C.I.P.A patients must be towards the dangers of life.
One of these is warm, and the other is very hot. Start here, move to the hot one, just a few seconds, then back. We're going to monitor activity in your brain while you do it. If you feel any response to the heat, it could indicate a vascular problem.
How's my mom doing?
She's okay. Do you feel anything?
No. What does okay mean?
She's still in surgery. They tell me it's going okay. You can take your hand out.
And you didn't ask anything else?
Take your hand out of the water.
What's going on with my mother?
You just got second-degree burns.
I'll be fine.
Hello, my name is Emma and I'm going to be picking up where Ragnar left off. Toilet training also tends to be difficult for children with C.I.P.A. They have difficulty telling when they need to use the restroom and often suffer from constipation because of decreased intestinal motility, so toilet training can be very difficult. One of the biggest dangers for a child with C.I.P.A is overheating. The A part of C.I.P.A stands for anhydrosis, the inability to sweat. Sweating is important. It's a way for your body to regulate its temperature. When your body can't get rid of excess warmth, such as on a hot summer day or after exercise, it overheats. This can lead to febrile seizures, seizures brought on by fever or overheating, and even death in serious cases. A child with C.I.P.A can break a leg and never notice. Fractures and burns are very common. A problem that's more difficult to deal with is joint deterioration. People with C.I.P.A tend to overwork their joints. When you're sitting or sleeping and you're uncomfortable, you adjust your position to take stress off a certain area of your body. Someone with C.I.P.A won't, and the extra wear and tear can cause swelling and serious injuries to the pelvis, knees, and other joints. People with C.I.P.A often suffer from osteomyelitis, a bone infection that can result in reduced limb or joint function and even amputation.
Now, as we saw earlier, C.I.P.A is part of a group of disorders referred to as HSAN disorders that result in trouble perceiving pain and temperature. C.I.P.A, or HSAN type 4, is one of the most severe. It's the only HSAN that causes inability to sweat. HSAN 2, or congenital insensitivity to pain, is a lot like C.I.P.A. People with HSAN 2, which is also called congenital sensory neuropathy or CSN, suffer from the same kind of profound sensory loss, but they retain the ability to sweat. C.I.P.A is an autosomal recessive disorder. This means that for someone to get C.I.P.A, he must receive a copy of the gene from both parents. Each of those parents must have a mutation on the autosomal chromosome, the chromosomes that aren't related to gender. Research indicates the mutation on the TRK1 gene, which appears to control nerve growth, may be the culprit. There are no reliable statistics statistics on how people have C.I.P.A at this time, but the condition is quite rare. It does not seem to affect one gender more than the other. So how does not feeling pain work? First, let's learn a little bit more about the nervous system. Your nervous system is made up of your brain, cranial nerves, spinal cord, spinal nerves, and other bodies like the ganglia, and other sensory receptors. Your nerves are what carry messages from your body to your spine, and your spine carries the messages to your brain. If you cut your finger, receptors in your finger send a message to the nerves to the brain that yells, ouch! Your peripheral nerves are important to feeling pain. They end in receptors that sense touch, pressure, and temperature. Some of them end in nociceptors, which sense in pain. Nociceptors send pain messages in electrical impulses along the peripheral nerves, which then travel through the spine and then to the brain. Nociceptor axons are usually unmyelinated, which means that they are slow. Myelin is an insulating sheath that forms around nerves and helps with impulse conduction. The more myelin, the faster the message carries. The axon that carry the pain message from the nociceptors can be either myelinated or unmyelinated, which means that pain messages will travel quickly or slowly. Which path the pain message takes depends on the type of pain. Severe pain travels on the fast path, while the lesser pain travels more slowly. This process doesn't happen for people with C.I.P.A. Studies have found that nerve conduction in people with C.I.P.A appears to be fine, so it's not the message is getting lost. Some studies have shown a decrease or absence of nerve fibers, both unmyelinated and myelinated. With those nerve fibers, the body and brain cannot communicate. Pain messages don't make it to the brain because no one is sending them. People with C.I.P.A are also missing a nerve supply in the epidermis and the eccrine sweat glands. There are two types of sweat glands, eccrine and apocrine. Eccrine sweat glands are all over your body and are used for body temperature regulation. Because there are no nerves in the skin, the sweat glands, there is no way for the body and the brain to communicate with one another, resulting in anhidrosis. C.I.P.A doesn't have a uniform clinical pattern. For example, most people with C.I.P.A have some form of mental retardation, but not all. In some patients, it's very serious, while in others, it's very mild. The location of the mutation responsible for C.I.P.A is believed to be located on chromosome 1, quadrant Q, section 23.1. Observed cases where DNA sequencing was carried through on the patient and their parents revealed a deletion, a splice site aberration, and a missense mutation in the tyrosine kinase domain of NTRK1. These findings suggest that defects in the NTRK1 gene causes C.I.P.A, and the whole nerve growth factor has a crucial role in development and functions of the nociceptive system as well as body thermal regulation.
Children with disabilities have special needs, but children with C.I.P.A have very specific needs. Parents try to maintain a balance between being vigilant and trying not to smother their kids by being overprotective. Parents with a child with C.I.P.A might feel very isolated because it's such a rare disorder, but most people don't understand what daily life involves. If there are other siblings, a parent might worry about the family revolving around one child and leaving the other out. Parents worry about their child being accepted by his peers, what his future will be like, and what will happen to the child when the parents are no longer around. C.I.P.A doesn't have a cure, at least not yet. So instead, people with C.I.P.A and their families have developed some adaptive strategies to help them in their daily lives. Each person with C.I.P.A needs an individualized plan of care that helps with his own symptoms. As with any rare disease, the future for C.I.P.A is in research. With luck and a lot of research funding, people with C.I.P.A and other 8 SAN disorders might be able to go about their daily lives more easily. And as always, thanks for watching. Blir det live? Kan jag säga?
I got it. Filming this was a lot of fun.
We learned a lot about C.I.P.A and everything that it involves.
Thank you for watching my video.
That's a wrap.
Okay.
Hi, thank you so much. We really enjoyed making this video.
We learned a lot about C.I.P.A and video editing and recording as well.
We hope you enjoyed the video and have a great day.
Perfect.